We see that patients with Bell's palsy develop a congestion. They develop edema in the paralyzed side of the face, and they have that difficulty because of facial expressions are not coming because the vascular insufficiency. If you see that also that paralyzed side, whenever it is gravitationally dependent, they develop the more edema, so which is actually a venous insufficiency of the arteries of the face. Arteries, pardon me, the veins of the face. Okay, so it's the maxillary, the mandibular, and the oral veins. All this which actually drain into the external jugular vein, not the internal jugular which forms for the sinuses in the brain. So this is again an important one. So vascular manipulative therapy, we are going to see this for the face. And this face, the venous anatomy is not actually part of the routine musculoskeletal fellowship, the anatomy one. So today it was not there. So remember that external jugular. Internal jugular is the venous vascular manipulative therapy. I am going to demonstrate as adjunct for the disc bulge. Patient who is having a cervical disc bulge or having a lumbar disc bulge, both of them have positive radiculopathy with sign. Okay, the Nafziger sign, which is actually the manual compression of the internal jugular. So can we do anything for that VMT so that the pressure here could be redistributed, the CSF pressure, the cerebrospinal fluid pressure, or the intrathecal pressure? Okay, what is getting influenced through the intradiscal pressure? Okay, and then the next one you see for thorax, especially the pulmonary veins, which is important for the pulmonary edema, which is post-COVID. So for that, there will be the third criteria there, which we'll see the condition or whatever the clinical example in the vascular manipulative therapy. Of course, the most commonest, the two things, which is varicose veins and the deep vein thrombosis, which will be seen for the lower limb, the varicose veins for the calf, and also deep vein thrombosis for the femoral nerve, femoral vein, so which we'll be seeing there. Okay. Upper limb, if you are seeing for thrombophlebitis, a little bit in the dorsal or the lateral antebrachial branch, okay, of the vein. So that again can be seen. So these are all the scheduled one which you are going to see for the vascular manipulative therapy for the venous disorders, the dysfunctions. Of course, the major course, the specialist course on VMT is coming up in September, where I am planning like 10 master classes, 10 regions. So head and neck, scapula, shoulder, elbow, wrist and hand, like that regionally. So thorax and the rib cage, abdomen, pelvis and hip, knee, foot and ankle. So what happens here is, you are aware of arterial also and venous also, locally everywhere, how they can influence the muscles in that region, the nerves in that region, the joint and that vascular supply. So how you can actually, like a joint which has an effusion, venous drainage is important in addition to the lymphatic. Whereas a joint which is having a degeneration, you'll be more looking into arterial VMT so that you can improve the circulation, so that through the cartilage, the synovial fluid, little bit you can have a recycling, okay, as a conjunct to the exercises, okay, intermittent loading of the cartilage, so it brings the synovial fluid. So various physiological to physical and also, of course, the pathomechanical will be integrated together in the specialist course. Of course, the next upcoming certification course, the 2 hours one, we have the venous disorders, the 5, 6, and then we have the typical treatment options. Of course, the VMT techniques are almost similar with respect to the arterial dysfunctions, but the positioning for the superficial veins, plus muscle contraction for the deep veins, and of course, the anatomical orientation of the vein, what it can influence the mechanics when you're using for upper limb versus lower limb. and how we are applying that as principles will be seen tomorrow in the vascular manipulative therapy for venous dysfunctions, the masterclass certification course. So today we had the clinical anatomy of the venous system, and we had Dr. Darshana, Dr. Ritu, Dr. Archana, and also Dr. Krishna Kumar all accompanying this. So inputs for the course tomorrow. And I know that the anticipation for tomorrow's course only made today's session to be more enlightening with all this, of course, the venous models, and definitely it brings the 3D perspective rather than a technical or a digital visual effects, which the vein can come as I am talking. Okay, so here the veins can appear, but that is only technical side. But this is manual, and what we had was the foundation for the untouched domain of venous system and venous disorders in manipulative therapy. Okay, so Dr. Ritu ma'am and Dr. Darshana can provide their inputs.
Yes, sir. Yeah, I think it's always wonderful to learn something new, to improvise our practice, because if it comes to venous dysfunctions, as I just mentioned some time back, that we understand only elevation, or at the most elevation and exercises, or we do maybe what we say, compression bandage. Yeah, compression bandage. So if we can take our practice one step up by learning vascular manipulative therapy, which we already learned in the arterial system. But again, as you taught us today, the whole anatomy of the venous system, it's going to be very interesting to learn how manipulative therapy for the venous system is going to have an effect on these conditions, what you just mentioned. We don't think, I mean, edema, yes, we know that it is a venous dysfunction. But if we can do something better and we get good results of it, then I think, yes, it's wonderful to always learn something new and then experiment there. That
Okay.
looks wonderful.
Yeah.
So today's session, yes, I mean, with all these models, it has made it more interesting and more exciting to learn what is going to be there tomorrow. Because it's like, now we know the basics, we know the whole system. So now how do we treat it with manual therapy? So that's something interesting. And of course, something new and untouched. We never do that as therapists. So that's why for me, it's going to be, I'm looking forward for the session for tomorrow. Yes, thank you, sir.
Yes.
And I think everybody should understand, because arterial system, venous system, and lymphatic still is like, people do, therapists do have some aspects there, where we treat the lymphatic systems, but arterial venous is something very untouched. And I mean, we say that maybe it's the last thing, but I think it should be the first thing what we need to, because if the circulation is improved, whether it is arterial, whether it is venous, if we have taken care of the circulation, I think the dysfunctions also, whether it is articular, myofascial, neural, all things are going to start falling in place if the circulation is better. So circulation is something very, very important, and which is neglected. So that's why I think vascular manipulative therapy is going to be of a lot of importance there. So thank you so much, sir. Looking forward for it.
Yes, Ritu ma'am.
Yes, sir. Very true words that ma'am was saying about that. We have to upgrade our skill, not only in a one thing, we have to learn everything, because if the patient is having a multiple dysfunction, so our goal is to learn all the treatment plan. If they have any problem, if we are not able to I think if we are not able to treat them, that time we feel that yes, we have not learned this thing. But when we are learning topic, and every topic as every month you take some new topics to explain in a very deep way, so it will give us a great idea to treat our patient, and we can easily even talk to doctor also that yes, we know about that what is the course of that particular area, either the nerve, artery, or the venous, or what is the, like today you have explained that the contraction, the deep veins, the contraction effect, and the superficial, how the elevation, the positioning change position can affect in the venous system. So these are the things we can discuss with the doctor also when they just write down to go to the physiotherapist. That time what our role is, that we can confident, we can understand, we can evaluate the patient dysfunction, either they are going through the arterial, because any dysfunction, arteries and venous are going in a affected position. So we have to learn these things. So it is very important, because when we start our school or college, the medical terms, we start with the arteries and veins, as ma'am was saying, but we have kept it as in a last way. But it should be first, because one is a giver and one is a receiver, and we are forgetting them, and we are going in a tunnel and treating everything, and we are not seeing that either the door is open or closed. We are just moving and knocking on the door, and that the injury on our head only, that we are not able to treat the patient. So this is the first door which we have to open with the arteries and veins. Then we can move forward toward the nerves and the muscle and the joint. So this course will give us a new way to treat our patient. I think it will give us a, like after cranium or after visceral, we were feeling confident that we know something which is going inside the body of my patient. So same like that, we can feel that their arteries and veins. So it will be, I think, more useful, and it should be mandatory for all the physiotherapists to learn this type of courses, so they can upgrade their skills better for upgradation, and as well as treating their patient in a better way. So they cannot worsen the symptom of the patient, because veins and arteries, always we see think that this is the cardiologist department, it's not our department. But after attending to this session, I think it is the physiotherapist department, not the cardiologist department. We should know better than the cardiologist, so that we can treat it if they are coming to us. So thank you so much, sir, for planning so this type of courses which are upgrading our skill as well as our knowledge. So thank you so much, sir. Yes, sir.
Yes, ma'am.
Yes, sir. Thank you, sir. Well, really, what I said, we can't explain you how much you explain. Yeah, it's really no comparison between other professor and you, because you are doing very hard work and you are demonstrating, like, yes, the patients कैसे समझे नहीं समझे, that you are demonstrating very well. So that really we can't explain you. Really, it's very fantastic sessions, and the way you are explaining about the veins, about this is lateral portion, this is medial portion, this is everything. So you are explaining very small type, like explaining. So really, it's so we can understand very easily, and I understand very easily. That's why I every time I eager to, whenever I have time, I'm really yes, I can attend your course. Really, it's thank you so much, sir. बहुत thank you so much, sir.
Okay. So this is actually the intro, or the what is called as the overview of the VMT for the venous dysfunctions. And on behalf of the academy, it is my duty to announce and also to ensure that maximum people participate in the course tomorrow that is happening, the rescheduled course, the visceral or the vascular manipulative therapy for venous dysfunctions. It's a 2 hours masterclass and certification course. Whoever registers or enrolls for the course tomorrow will get today's masterclass free. And of course, whoever has already completed today's masterclass will get additional discount for tomorrow also. So it's a dual package, so that people get the comprehensive picture from clinical anatomy to the vascular manipulative therapy. So enjoy the evening, and wishing you three the best of luck. Of course, Dr. Krishna, who's also off the screen. So we're ready to close this session and go for getting as tuned to the vascular manipulative therapy for the venous disorders.